What's up, guys? Dr. Uz here with the Dr. Uz Talks YouTube channel, and I wanted to talk to you today about doctors. But before we do that, thanks to everybody who's liking, subscribing to the channel, getting more and more messages and stuff like that. It's great, and I'll keep doing it while people are like liking the videos and stuff like that. So, what did I want to talk about today? It's about doctors, right? And you probably heard a lot about doctors in the news, like, why they're not accepting this pay, why they're striking, all this kind of stuff. And once again, whenever there's anything that is like this, I always see like doctors going on and going on to Good Morning TV or going on the radio and all this kind of stuff. And it's like they never actually tell you the real reasons why they're like striking and stuff like that. They kind of like sugarcoat it and say like, oh yeah, because our pay's historically been lower and blah. It's like we should have like had like this amount of pay to get pay parity, blah. And it's like it always cracks me up when I hear stuff like that, because it's like, why don't you just say the real reason why you won't accept the low pay anymore, right? When I was a junior, so when I used to work in hospital, I worked in hospital for about 2 years before I decided to leave and go and work in practice there again. I wanted to go and do oral surgery, but decided that hospital wasn't for me. And I used to earn a lot lower pay than what these guys do there now. However, the one thing that is always different when you're kind of like a junior doctor than anything else is you get a lot of benefits as a junior, and those benefits increase more and more until you become senior. And when you become senior, those benefits like absolutely explode in your ability to do them, because you spent that amount of time doing it, right? So when you're a junior, and I'll explain to you in the context of what I do there now. If I have somebody who's a junior now, junior dentist, junior oral surgeon, whatever, and they want to go and learn the procedure, well, what happens is they're going to be spending a lot of money on, trying to learn the procedure. And then not only that, they need to get mentored. They need to get people to come and watch them to do the procedure, get people to show them the procedure there surgically, and then make sure that they're supervised enough so they can do those procedures themselves. Now, just to give you an idea of the kind of costings, if you go and try and get somebody who is a experienced oral surgeon to go and stand next to you on the table, and like teach you how to do stuff, your bare minimum is going to be £1,500 to £2,000 a day, right? And I know that's going to shock a lot of people, but basically, to get a consultant level oral surgeon or implant surgeon or somebody else to go and stand next to you and supervise you is that amount of money. And that's not just once. You've got to do that multiple times. You've got to keep doing it again and again and again until you're competent, right? So most oral surgeons, implant surgeons, etc., and even general dentists there who have had this kind of level of mentoring have spent 50, 60, 70,000 pounds on mentoring, on courses, on all this kind of stuff, right? And because of that, of course, you've spent so much money there on it that this is the reason why, private dentistry is so expensive, because to get that level of education, to get that knowledge, to get that skill level, you have to have spent a lot of money there on it, right? So now let's talk about medicine there. Now, medicine, imagine if you had that level of parity there with medicine, okay? And you're a junior. So a junior doctor is anything below consultant, but we're going to be talking specifically about houseman, senior house. That's not the term there nowadays. House officer, senior house officer. I think they're called something else now, like foundation 1 and 2 or something like that. But basically, like, imagine house officer, senior house officer, right? So you're basically standing by the side of a consultant or by the side of your registrar who is an experienced person and learning the procedure. Now, keep that in mind, what I was saying about private sector dentistry, right? So imagine day in, day out, you're doing procedures, right? So in reality, that would have cost you thousands and thousands of pounds. If you imagine how many times a surgical graduate will be standing next to their consultant, right? You know, they'd be spending six figures getting taught, right? Having the consultant stand next to you. But it's a given, okay? And the reason why it's a given is because you don't really get paid that much money, okay? So when you're a junior, when you're a senior house officer, when you're a houseman, you get paid a very small amount of money. And the whole point is that basically you get the privilege of then standing next to your consultant, who is then going to pretty much give you almost one-to-one tutoring, which you're never going to get anywhere else. Imagine any other business where the person who's right at the top of the business, imagine even say you're like, I don't know, you're a footballer or something like that, right? And or basketball player, and like Michael Jordan's coming and giving you one-to-one tuition. Can you imagine? So many times when I was a senior house officer, it would be me and the consultant standing on the table for like 6-7 hours, right? Obviously the nurses were there, anaesthetist was there, etc. But that one-to-one is just like crazy to get that level. So you would accept that super low pay because of the fact that the consultant's going to be right next to you and you're getting an amazing level of education. Okay. Then the next thing is you basically go past that level. You go to the registrar level and you basically go to the consultant level. And once you're getting to that registrar level, you've gained a lot of knowledge and skill in doing a lot of procedures. You've been standing next to the consultant for a long time. You've been reading your anatomy books. You know pretty much most of the procedures, right? And especially when you get to the SPR level, you know a lot of those things. You just basically got to go and pass your consultant exams. So the reward of being the consultant would be that, okay, you've accepted that low pay for a long period of time. The benefit of having that low pay is that basically you're pretty much getting one-to-one tuition from an extremely experienced, surgeon or medic or whatever, right? And then basically what happens is that at that point, when you become the consultant, your reward is you still don't get a crazy amount of pay, but your reward is now you're allowed to do private work. Okay. And because you're now allowed to do private work, you can go do your NHS stuff, go on the weekend, go on the evenings, earn a lot more money. And all of those years of low pay doesn't matter anymore, right? Okay, you get the benefit of standing next to the consultant, learning all that stuff, but all those years of low pay go out the window because now you're a consultant. And most of the consultants back in the day would be in their early 30s, mid 30s, maybe surgical consultant, maybe late 30s. Somebody like a maxillofacial consultant, maybe 40. Okay. But now you can do your private, right? And you can earn a lot of money. You can do implants there if you're a max fat consultant. Plastics, you can go into private plastics, etc., etc., etc. And you're earning a lot of money, and that kind of sorts out the pay parity. Now, the problem is that what happens is that none of these consultant positions are a given, right? It used to be that you accept the crapness for like years and years because you're going to be able to become a consultant if you're good enough. And then once that happens, all of your previous kind of stuff that you've done comes to fruition, and you basically are able to go and go and work in a certain way, earn a certain amount of money, and have an amazing lifestyle. Okay, now what's happened is that none of those consultant positions are a given, right? A lot of people get into SPR level, may have passed consultant exams. There's no consultant posts anywhere for them to get into. They may not even be able to enter the consultant exams, right? So you now got to a level where you've accepted low pay for a very long period of time, and now you can't capitalize on that. And now you're in deep trouble because the way that the NHS works, it doesn't allow registrars to go and do private operations, right? And because it doesn't allow private operations, you can't get to consultant level, can't make your money back, can't get your pay parity from that. So where do you get it from? And this is why all of the junior doctors are revolting like crazy, because they're basically like, we've got no no guarantee that we're going to get to that consultant level. By the time we get to that, we're going to be in our late 30s, 40s. We would have had basically no savings, no nothing, seeing an infinite amount of patients within that period of time. Okay, we get the surgical knowledge, skill, medical knowledge, skill, etc. But what's the point if you can't capitalize on that because you cannot get to the consultant level? And that block at that consultant level is causing a lot of these kind of problems. And the issue is that nobody wants to talk about it, right? Nobody wants to talk about the fact that there's a block in the highest level of medicine at the moment, right? It's when you speak to medics, they will tell you, but they won't go and tell the public that actually this is the reason why, and we accepted low pay for a long period of time because we knew at some point we're going to get a decent amount of pay, right? Nobody accepts low pay forever, right? And this was their way out of it, and now you block the way out of it. Anyway, guys, let me know what you think about that. Do you think that the doctors are striking for no reason? Do you think they should just accept the low pay? I don't know. Let me know what you think. Until then, I'll see you again next time.